Good morning, Illini, or good afternoon, evening, or whenever you happen to be listening. Welcome to the first ever episode of Healthy Illini, and I'm excited you are here for this maiden voyage, this first stride on a grand adventure, the moment when you took a pivotal step in your journey to health and wellness. My name is Matt Schrock, and I'll be your host as we find tips and tricks and ideas on how to stay healthy and enhance your overall well-being. The goal here at Healthy Illini is to start conversations on how you can be the best that you can be, to find resources that will help you, and to help keep you well to excel. Because all of us, but especially college students, are extremely busy. We fill our time with so many things and then have even more new possibilities and opportunities presented to us on a daily basis. So we just want to offer a quick 20-minute discussion on a variety of health and wellness topics that is quick and easy to digest. So that being said, let's jump right into it. As I said, my name is Matt Schrock. I work for the University of Illinois here at McKinley Health Center in the administrative support side. I bring up McKinley because Healthy Illini is sponsored and supported directly by McKinley Health Center. And if you don't know or aren't familiar with our campus, McKinley is the only campus health center affiliated with UIUC and only serves enrolled students here. Within our building, we have standard medical clinics, a women's clinic, immunization and travel, mental health, health education, radiology, lab, pharmacy, and medical records, all ready to assist our students in not only their health needs, but also in taking ownership of their own healthcare as they transition out on their own. Now, you'll hear me each episode because I'm the host, but we'll bring in experts and professionals in various fields and also try and offer a voice to the students as often as we can. So today I'm pleased to bring that voice via some of the students who will be actually helping produce this podcast in various capacities. So welcome, guys, for being here. We have Emma Keynes, we have Ryan Lashak, and Joanna Ramo. We also want to give a shout out to Nate Wallander. He was our graphic design and marketing intern. He has since moved on to another position, but the logo you see on the website, a lot of that came from him, so we do want to give him his due. But guys, thanks for being here, and just if you would, just introduce yourselves a little bit and how you came to be in your current marketing roles and what your current responsibilities are.
Okay, I'll go first. Thanks for having us, Matt. So my name's Joanna. I'm from Winnetka, Illinois, about 2.5 hours out from the university. I joined the marketing department recently as a videographer and photographer. So working in the marketing department of student affairs, health and well-being auxiliaries at McKinley, the long name. I'm having a great time. We've done some really cool projects, and I'm super excited about Healthy Illini.
Hey guys, I'm Emma Keynes. I'm the social media intern here at McKinley Health Center. I'm from Barrington, Illinois, a northwest suburb of Chicago, and I'm an advertising major here at UIUC. I was actually on social media and I saw that this position was opening, so I knew that this would be a good opportunity for me. And I started in February of 2021, and so far I have loved it, and I post on McKinley's Facebook and Instagram.
Hello. I'm Ryan Lashak from Naperville, Illinois. I'm an ad major, video production minor, and here I do videos and photos like Joanna. She helps me out a lot, and been working here for just the last year or so. So it's been a great experience.
Now, Healthy Illini is designed to be a weekly podcast, about 20 minutes in length, just a quick hit on topics, and not to be the end-all of any discussion or to exhaust every aspect about every topic, but just to start that conversation and to get an initial thought or, pique someone's interest and go forward from there, because Healthy Illini is about building the community here. It's not a lecture series. It's not going to be just facts and data, but an interactive experience, hopefully between me and guests, but also with the listener. And so with that in mind, what are your roles? Because you kind of talked about what you're doing as far as marketing, but you do a lot of things outside the podcast as well. But specifically with Healthy Illini, what are you guys doing, and how do you see your roles here? But also, do you have any experience with this, or is this a new venture for you as well?
So Ryan and I will be helping produce and edit the podcast. Very excited about that. So we're kind of doing the behind the scenes work. I think it'll be great because we're all students. I forgot to mention in my intro that I'm a media and cinema studies major, English minor, and I'm going to be a senior. So I've been here for a bit. I'm really excited to be working on the podcast. And yeah, I think the editing will be mostly what me and Ryan are doing.
Yeah, so Joanna and I are going to be switching off in the editing of the podcast, putting it all together. I kind of relate it back to this idea of a puzzle. We're kind of the puzzle masters. So we'll be taking all these different pieces and putting them together for you guys to have a nice audio experience. But I've gotten into podcasting before, but It was a podcast with one of my friends. It was taking random questions about love and talking them through. So you can imagine how that went. Our one episode series did not make us famous, but it did teach us some valuable lessons about podcasting.
So I'll be promoting the podcast on our social media platforms. I want to be posting this on every episode that comes out. I'll be promoting it and making sure that our followers and fellow Illini see this and they're able to access it through our Facebook and Instagram. And I have never worked a social media position before, but obviously I'm Gen Z. I know social media, so I wanted to bring that voice to McKinley, being a student myself. So I'm really excited. I'm learning through this position, but I'm also bringing my experience with being a social media user and being a student to McKinley Health Center.
And hopefully, as we go forward, you'll as you're listening, some of the personality of all of us, me as the host, the students who are helping behind the scenes, some of that personality will come out. And we really want this to be an organic thing, something that we learn as we go, something that we develop as we go, and develop that in conjunction with students that interact with us as well. But I'm really excited for all of you because you have differing experiences, you have differing views, and together I think we can create something really great. So as far as this podcast specifically, you kind of talked about, what you do about it and touched on a little bit, but really what excites you about this podcast? What really gets you fired up? Because why are we even doing this podcast? What's the reason behind it? Why are you involved? Is it checking a box for a major? Is it checking a box for a job? Or is there some passion that you're wanting to bring to this project?
I think that this podcast is going to be like a great resource for students because it's very natural, and I just love podcasts because you really feel like you're in the same room as that person. And I think that students don't really have access to a resource like that. So this is like completely brand new. And I think that it's really exciting, and students are going to be able to get to know McKinley and also learn more about health and well-being in a more like raw kind of way, and they'll get to know more students and staff and just fellow Illini. So I think I want to be a part of that because it's something I would listen to if I wasn't part of this podcast, and I think that it's just really exciting, and we're definitely like ahead of the trends and stuff, so it's exciting.
Yeah, I completely agree, Emma. I think that podcasting is such a big thing right now. I'm really glad that we're trying to do something like this. I think it's a great way to reach students. I would listen to it. I think podcasts are a great thing you can listen to walking to class, and this is all about health, and it's not going to be a scripted thing. Like it's supposed to be informational, conversational. I'm really excited to hear from those professionals about things such as like how to have a healthier diet and maybe I don't know, all types of mental health issues, things like that. I think that's really important. And I think on a campus this big, those resources, knowing that those are there, gets really lost. We just came back from quad day today, and like it is overwhelming. There's so much going on campus, but your health is really important. And I hope that this could be like a quick little show that someone can listen to and could like help their overall well-being.
And there are so many new things. Like we had that quad day experience, and there were so many things I hadn't heard of before that were for your health and wellness and well-being that I'm like, wow. So there's a gold mine of information here for you guys to soak up in your ears. And the topics are amazing. But the thing that excites me is being the videographer here. Like, there's not a lot of time where you can pull out a video, sit down and watch it. Maybe it's 20 minutes, if it's this podcast. But your ears are much more free, and there's so many more times where you can be listening. So that's super exciting for me, is, being more accessible to audiences.
I like that you mentioned that there's so many things you didn't know about when you're talking about quad day. And I want to kind of come back to that in two different ways. I'm going to start with the first part, but one of the advantages we have here on this campus is because we are such a big campus, we have so many students with so many diverse backgrounds and so many interests that there's all kinds of opportunities that you can connect with. The downside of that is there's so much information about opportunities that you can connect with that if you walk quad day and you try and get information at every single booth out there, your brain will melt. it just eventually you will melt, because if you try and get in-depth information on every single aspect, it's tough. And so sometimes that noise, you lose opportunities because there's so much noise coming at you at once. There's so much information coming at you at once, and it's all good. It's all viable, but it's hard to process. And so hopefully here through Healthy Illini, we can help cut through some of that and get to the heart of a couple issues and start the conversation, and then give resources where you can follow up with it. But one of the things you mentioned is there's so many things with your health and well-being, your well-being and wellness and all those things, that we are sponsored by McKinley. And for a lot of students on campus, they know McKinley because of free condoms. They, let's be honest, it's there and they know it. The other thing they know about McKinley is spit testing from last year. If you're here last year at all, spit testing, if I say Dr. Parker, you think the spit doctor. That's what he was, because he's the director here, and all the orders signed off with his name. So everybody who did any kind of saliva testing saw his name. But you guys are not new to the campus. You've been here, but you've been in kind of two roles, where you were a student and now you're working with McKinley. What are some things that you've learned about McKinley as a health center that kind of surprised you? Were there any changes of perception, or things you're like, I didn't even know this existed? What's been your experience now that you're kind of seeing the behind the scenes or being around it a little bit more often?
I was definitely the same way. I mean, I only saw McKinley as where I would go if I needed to make an appointment or like refill a prescription. But once I started working here, I realized that there's so many people that are here to help students, and there's different areas and services and resources. And I've learned so much about our health education program. I had no idea about our health education program prior to this position, and I've gotten to know all the staff, and they're so incredibly nice, and they are always willing to help students in so many different fields or different areas, like nutrition, sexual health, multicultural health, fitness, and stress management. So I think it's really cool to be in this environment with these people, because there's just so much to learn at McKinley, and there's so much guidance and assistance that's available for students.
Right. I feel the exact same. I have that actually written down in my notes. My perception was that this is the place to go if you were sick.
Yes.
Right. Yes. Now that I'm here, it's this thing where you've had that experience where you're a freshman, and honestly, I still feel like I'm a freshman because of everything that's transpired. So I have all these questions, and now that I'm here, I'm like, okay, I need to get the answers to these questions and put them in a way that we can. So I'm really, it's very exciting to be in this position, to be able to push out the content, that you want to see, because you were the audience not that long ago. Want to know how to budget your money, want to know how to buy health insurance, or even what that means. McKinley is so much more than the place to go when you're sick.
Yeah, I couldn't agree more. And I also think a perception that I had was that you had to maybe have money to pay for some of these things, like to see a dietitian or something. And that's not true. Every student's paying a fee. You can come here and why wouldn't you get free things? Take advantage of that stuff. If you think you need to talk to a counselor, go advocate for yourself and do it. They're here. They want to help you. It's really cool. I think that a lot of other seniors that I talk to, we all agree that senior year you start to realize, oh, there's all these things that I could have done or that were there for me that I just didn't. I just let go over my head the 4 years. And don't be that person. Take advantage of it now, because then you're in the real world, and those opportunities aren't there as much. And I just think it's such a great thing, and I'm really excited that they're there, and we're going to help inform. And I'm excited to bring a student perspective, and for all of us on the marketing team to kind of talk about those things that students want to hear about and learn about. We want that input and those interesting topics.
So talking about those things that students want to know about and want to learn about, I want to change the approach just a little bit and ask you on this. As a student, not necessarily as a marketing intern or marketing worker or a part of McKinley necessarily, but just as a student, as an Illini student, why should you listen? Why should anybody listen? Why is this a viable thing? Is this just more that we're putting out there? Is this just something that we're just throwing out there just as something else to do? But why is it viable for you? And what excites you as a student about having this podcast? And what are some topics that maybe that you want to hear about or learn? Because college is all about learning and connecting, and we want to try and do both here. So we want it to be that organic experience, that genuine, authentic experience where we're connecting with people and relating to where they are. And your health, quote unquote, is such a huge, far-reaching topic and an idea, and it's so complex. But we want to have this safe space to interact. So going forward, what are the things that you're looking forward to as a student, or the things you want to hear about or touch on as this podcast grows?
I remember like last year, I was looking for podcasts that kind of targeted college students, and there really aren't that many out there. So this is super exciting because this targets like Illini and college students. So I think I'm excited to hear advice for college students because that's something we want to listen to, and it's hard to find that out there on podcasts. So I'm looking forward to learning about like my health as a college student, not like an older adult or like a younger person. And college is such a different lifestyle, so it's awesome that we get to hear about like specific advice to college students. And I think one topic that I'd love to talk about or hear about is probably stress management. I think that it's not really brought up enough, and college students can be pretty stressed a lot, and it'd be nice to hear like specific advice like from an expert about how to manage stress in college.
Yeah, Emma, I totally agree with you on that. Like, so I have one little tweak though. You said there isn't a lot of advice being given out to us. I think there is too much advice being given out to us.
That's true.
And the thing about this podcast is that it's good advice. It's being given by professionals who have experience in these areas, maybe even schooling in these areas. So it's really the correct information to get to you. And it's just like I said, it's information here for you to take, and I don't know why anyone wouldn't. I definitely will be.
Yeah, bouncing off that real quick, I think also like after this really hard year with COVID, everyone kind of realized that health is like so important. I think like I never really thought about my health on a daily basis before this last year, and I think that everyone can work on themselves, and like I think that's something that people want right now, and there's been a lot of like hard things that people have gone through this year, so I'm excited to be a part of just a 20-minute thing that could like make someone's day better. And I realize that a lot of my friends really do listen to podcasts about like health and mental health, and or podcasts that kind of make them forget about the things that are happening in the world. So I think that we can like hit on that niche that people want, and like Ryan said, you can feel good about the information because it's actually coming from professionals, but hopefully it'll come to you in a way that's like cool and conversational.
And that's the idea, is the conversational side. I like what you said, Ryan, about advice coming from a lot of places. We want to give advice, but we don't want it to just be advice. We want it to be advice that causes a conversation, advice that causes feedback, advice that causes, hey, I want to know more, or this wasn't clear, or, this is my experience. We want to interact in that. And so at the end, we'll give a couple ways you can interact with us, but we don't want it to be the end all of the conversation. We want it to be the start. And, with especially like you all said, with COVID and all the situations of the last school year, mental health, physical health, emotional health, these are all at the forefront of everybody's minds, and stress is high. We're back on campus. It's wonderful to have that feel, that vibe, because we've been at McKinley through the whole thing. We really didn't shut down because we were trying to provide healthcare, but there's a definite different feel now with students back on campus. And but with that, we know it's stressful because everybody's back on campus and it looks and feels a little bit differently. And so if you're listening to this and you're feeling, like there isn't anywhere you can turn, you don't know who to talk to, you're not sure where to start, that's what we want to be. And you guys have talked a little about your passion of it, and just to share a little bit on my side why I'm hosting this, one I was asked to, which I'm happy to do, but for me this is a labor of love. This is a passion for me because I'm the elder statesman in the room. When I graduated high school, I came to U of I, and none of you were born yet. But I came from a town of 2,000. My high school class had 35 people in it. And I came here and just was overwhelmed by the culture shift and being here, and started to drown. I didn't have to study in high school, and suddenly I needed to. I didn't know how. And I dropped out after my sophomore year because I didn't know where else to go. I didn't know what to do. And I never once even came near McKinley. I lived 2 blocks away, had no idea it was here. I probably heard about it, but didn't follow up with it. And I felt like no one could relate to who I was. No one could relate to where I was, and that I was I was an imposter. I had imposter syndrome. I didn't belong here. I didn't fit in, and I left. And if there's anybody listening and they hear a topic that we're talking about and says, you know what, I identify with that, or that resonates with me, then that's worth it for me, because it gives an opportunity to reach those and to say, hey, look, you're not on your own. We're here to help. And, we hear this story, and you guys talked about it too, but when you first came in, and now you're the juniors, seniors especially, you're like, oh, I wish I would have known. I wish I would have been aware of these opportunities. I wish I would have known what was going on, what I had before me. And so I love hearing that from you. And that's why we want the student voice, because we want it to relate with the students. So hopefully we can get your guys' opinions as we go. And those who are listening, by all means, let us know what you're thinking, what you want to hear about. We have topics lined out every week for a number of months. But, if we find there's a definite shift that, hey, there's a lot of interest in this topic, or a lot of interest pointing this direction, we want to follow that, because we want to be viable for where the student body is. We want to be viable for the campus. And, things can change quickly. We're February of 2020. None of us thought we'd be where we are right now. Things can change really quickly. Sure. Guys, any last thoughts you have on where you'd like to see this go, or anything you want to speak to the listener and let them know what you'd like to share with them as somebody who's now being a part of this podcast?
Well, this is something very random, but it's something that my boss talked to me about recently that I thought sounded so cool. Like, this is an example of something I think, like, one of the topics we're going to touch on in this podcast that I was like, I would love to hear more about this. So we were going to talk about seasonal depression disorder, and, like, we will have, like, those lamps. I'm pretty sure they're called happy lamps. I've seen it in an episode of Broad City, actually, and I was always like, what is that? It's like a running joke in one of the episodes, but, like, we'll have those to check out, you know what I mean? And my room last year faced the building next to me, and I got no sunlight. I feel like I was going through that, and I didn't understand, and, like, it's so cool. I'm so excited to hear from, like, students and hear their stories also dealing with all these issues, because I think, like, learning people's stories also helps you understand everyone around you and create empathy, and I think that's just an amazing thing.
And that's a perfect example of the kind of organic interaction that we want to have. So if you're listening, you're like, I want to know about this, or that makes me think of X, Y, and Z. That reminds me of this. Let us know, because we want to know what you're thinking. We want to know what you're interested in, and we want to be supportive of that. And there you have it, the first ever episode of Healthy Illini. So thank you for being here. I'm so grateful that you came along for this pilot episode. But listening is just the beginning. That's just a start, because we want the conversation to continue. So we want you to connect with us. A couple ways you can do that. If you go to Anchor, ANCHOR, anchor.fm/McKinley-Health-Center. Those aren't slashes, those are dashes. You can find a box where you can leave a voice message, basically a minute-long voicemail. And you can give us feedback, you can ask us questions. Now, be aware on that, we can't follow up with that directly. So unless you leave us your email or a way to contact you, we just have your voice message that we use as input. But if you want to have direct interaction through an email, if you will email us at mhcmarketing@illinois.edu, that is the email link that we will use, and we can interact with you there. You can also interact with us on Instagram. If you're not familiar with that, we do have an Instagram page, and it's McKinley Health Center, no spaces. Follow us there for all kinds of announcements, but you can also interact with us on that. If you found us, but you're not sure where else to find us, or you found us and you want a different way to hear podcasts, we are listed on Spotify, Breaker, Google Podcasts, Pocket Casts, and also Radio Public. We are working on Apple Podcasts, but at the time of recording, it was not quite finalized yet, so unfortunately we can't be found there. But we do thank you for joining us today. You are on a personal journey, no matter where you are in it. You are important. You matter. Your health and wellness are important and matter, and we are here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we will catch you next week on Healthy Illini.